Good evening. It is Thursday, December 19th, 2024 at 7 o'clock p.m. This is the North Andover Board of Health, and I officially call the meeting to order. We will start with the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next items on our agenda are new business, starting with the 2025 Board of Health meeting schedule. So we can take a look at the proposed dates and any discussion on the proposed schedule for 2025. Did we wind up moving the spring break one, or is it still posted?
I'm glad we're mind melding right now.
I was like, there was a date that we were.
Remember that right now too.
Okay. That's what I couldn't remember which one was the issue.
I have 3 kids. It's
Is
like
it-
the first thing you
Yeah, no,
think
that
about.
one's still the same.
Is
That's
it
during-
the April that's the one?
Yeah.
Okay. So perhaps look for a different date in April. Is that what we'd like to recommend?
Yeah.
Okay.
February's the week after vacation.
Correct. That one I think
Yep.
was okay.
Yeah, because that's the 14th through the 21st.
Yeah.
Yeah, I think the rest looked fine, and there was no additional comments, I think, besides that one.
Just to make sure we book the room for April 17th versus the 24th for the meeting schedule. Yeah. Just make sure we have the room on the 17th versus the 24th.
It says the
I think-
17th.
No, we want the 24.
You mean on the 24th?
Oh.
24th versus the 17th? Yeah.
I have
Or-
school vacation week as the week of the 24th.
Yes.
So
Yeah.
so we already
the
moved it
21st is,
then.
Well, then that would have already been moved then, because it says the 17th.
yes.
Oh,
Just
okay,
make sure we
alright.
have the room here, because.
Okay, so it was already moved. Okay.
The third Thursday, I think, but if we book the room first, we're good.
Okay. So tentatively, April 17th, if we can get a
Yes,
room.
yep.
If not, we'll find another date in
Correct.
April. Okay, but stay away from the 24th.
Yep.
Done.
Fair enough.
Any other concerns with the current proposal of the schedule?
How does November look?
I have no idea. It's 11 months away.
So 25th would be the,
That should be the week before.
The 27th is
27th,
Thanksgiving,
yeah.
so
I
the
think it's the
20th is
week
the week
before.
before. Just make sure we get the room for that one too. And then December?
I mean, that would be the same as
Same as
Same
this
as
it's
week.
actually the same as we're dealing
Is
with.
this late? Would people prefer to go like a week earlier? You think that might help with, or not really?
I have no
Okay.
preference.
Yeah, it's
Okay.
the same.
Okay.
We just cancel meeting and have a Christmas party.
How about, no, are you suggesting we combine the November and December meetings?
Possibly, yes.
Okay, well, we can look into that.
All right.
I mean, typically November and December are lighter agendas, so I think that makes sense to
Yeah.
have 1 versus 2.
And I kept this one light because it is Christmas.
Yeah. Yeah, I think we did that also in June and July, so maybe keep that as a possibility to combine those meetings,
Okay.
depending on agenda items. I think we'll get more attendance if we do that.
Yeah.
Okay. You said we don't need a vote for that, just discussion?
No, just discussion.
Okay.
If you guys want to vote on it, that's the tentative schedule for the year, we'll post it,
Okay.
and then we'll be good to go.
Okay, so then I do need a motion to approve the schedule as we
I-
just reviewed it.
I hereby move that we approve the schedule as read.
A second.
All those in favor?
Aye.
We have a proposed schedule for 2025.
Awesome.
Okay. Continuing on in planning for 2025, we have the election of board officers vote. So there are 2 positions to be discussed. One is the chair position. The second is the secretary. We can accept nominations for each one, and then we can vote for both at the end.
Okay, I'd like to nominate Pat for chair.
Okay. Pat is not with us this evening, but has
Does it need to be seconded or?
I don't know.
Yes.
I was-
Point
well,
of information.
Yeah.
yes, it will need to
I
be.
second it.
Okay, okay. I was just gonna say Pat accepts the nomination, so.
Oh, I didn't have a choice at this point.
So we have a first and a second for the chair. Why don't we go to secretary and then we'll vote for both?
I nominate that Jennifer be nominated for secretary.
Accept the
I
nomination.
accept.
Okay. And I will second
There
it.
you go.
And then we'll do a vote for both. So Pat as moving into the chair role and Jen moving into the secretary role starting effective January of 2025.
Yep.
Okay. Can I have a vote for?
Do they need to be independently acted on, or is it collective?
You can do a collective since.
Yeah, so we have a
Okay.
first and second for both. So all those in favor of both of the chair and secretary roles?
Aye.
Aye.
Okay. We have a new chair and a new secretary. Congratulations.
There you go. Very nice.
And that makes this my last official meeting as chair.
Is it, I don't know.
Congratulations.
Congratulations.
A little bit of a
Thank you for your
congratulations.
years of service.
Thank you. I'm not going
And
anywhere.
continued service.
I was gonna say,
And
I'm just-
continued
Years of
service.
service.
I'm just moving. I'm just
That's
sliding
fine.
down. I'm sliding on my way towards the end of the table.
Yep.
And then the last thing for new business, last but not least, is the introduction of Craig as the new health inspector.
So as you know, Shanine had taken the regional position, so she's still with us, but in a different role. So we have hired Craig DaCosta, and he's here to just give you a little rundown on himself.
Great.
Sure. Yeah, I got 30 years of restaurant background experience, which I felt kind of obviously translated well here. I'm a resident in town. My kids go to school here, which is great. Been here about 6 weeks now, 7 weeks now. Just been pounding the training. Got 20 courses done on Mass Train, 24 done through the FDA. And then I have my certified pool operator class lined up for January, as well as the housing inspection training course as well for January as well. So busy.
Yep. He's
That's a lot.
absorbing it all. And he's been going out with the regional trainer. He's gone out with and done inspections with. He's been with Shanine. He's been to a few meetings in the region. Been to Andover for some of their meetings over there.
Yep.
So he's hit the ground running. It's been fantastic, but big learning curve here.
Absolutely. Craig,
Sure is.
what school for the kids?
Thompson and the
Thompson.
kindergarten as well.
Okay. Cool.
Yep.
Cool. My kids are a sergeant. So.
Oh, nice. Very nice.
Youngins.
Yeah, definitely.
Yeah. Very young.
And we also have a new administrative assistant, Jen Battersby. I thought you came to our last meeting, but I was mistaken.
No.
No.
So we get some new staff in the department. We're doing good.
Very nice, welcome.
Yeah, welcome to both of you.
Welcome one, welcome all.
Thank you.
If there's anything the board can help either of you with, let us know. We're gonna move on in the agenda to communications, announcements, and discussions for general updates.
And we'll start with Carolyn.
Starting in the new year. I wasn't ready here. Sorry. We've been working with Annette and, why am I spacing? Leanne
Leanne.
on doing more education for the community. So I got trained to be a CPR instructor, and we're gonna all get trained to be Narcan instructors to hopefully do more community education in the new year.
And Leanne trained me in CPR, so I got my CPR certification.
Very cool.
So
Very nice.
Yep. Right in this room, actually.
Very nice.
Is it okay to ask a question?
Yeah, of course.
Just as always, because it just feels like we just move past and don't talk about it very much. Anything new on the COVID front or anything emerging worth discussing?
So the numbers are, spiking up a little for respiratory season. So we are having a little increase in flu, COVID, RSV, and even norovirus. But that's typical once everybody starts migrating inside and doing the holidays and stuff. But we do have a ton of at-home tests downstairs to give away for anybody who needs an at-home test for COVID.
You're
Yeah,
doing a lot of them, too.
Yeah,
Yeah.
it just seems like there are now RSV. You might as well do RSV/flu/COVID as the regime now for the
Yeah,
kinda,
it's been happening every winter that
the winter
we kind
going
of get
forward, I guess.
slammed
Endemic.
with all the respiratory illnesses.
Yeah.
Apparently it's here to stay.
Thank you.
right, one thing I didn't have on the agenda, which we need to do, and I forgot to put it on here, is appoint Craig as an agent of the board.
Oh, okay.
So you have to make a motion to appoint him, second it, and then vote.
I move that Craig be admitted as a agent of the board.
Correct.
I second.
All those in favor?
Aye.
You're now officially an agent of the Board of Health.
Excellent.
Welcome to the club.
Thank you.
All right. Brief update. Been looking into the tobacco scanners. Ron's gotten some more information on that for me. A lot of the vendors, he said, are doing it on their own, which is good. And he's still trying to work on finding out how much they cost. Because I'd like to try to get them some help or some grants to get these ID scanners in. It's the easiest thing ever. There'll be 100% compliance rate if they have them, but he's still getting numbers between 500 and 10,000.
Oh, wow.
So I guess maybe it's the type of system they have.
It's quite the range.
Yeah, exactly.
And for a small business, that's
And for small business, that's a lot. So not requiring it, I think, is the right way to go for now. But if he can get some more information, and he's still looking into it, and find either a company that has a decent price that's low and still will work and will be reliable, then we can maybe talk about finding grants for some of the retailers to actually implement the ID scanner for all tobacco sales. Aside from that, been looking into vaping detectors for the schools and the bathrooms. Was it really?
I just wrote down vaping high school.
Is that a big thing?
It's
this
been
point?
a big challenge because there's a lot going on in the bathrooms, and then there's been a lot of parent complaints because they're locking the bathrooms to try to avoid the vaping, which means kids can't find a bathroom, which, I mean, I've had my own daughter come home and say that
Yep.
it took her so long to find a bathroom that then she's getting accused of vaping when she was just trying to find a bathroom. So, but there have been mentioned, the school did reach out and said that, like, you know, they're aware of the problem and they just don't have funding to put the vaping detectors in, but they're finding that other neighboring schools have found that to be a helpful solution. So I didn't know, as the Board of Health, if there's anything we can do to sort of
It'd
help
just be
that.
detecting an aerosol, essentially, wouldn't it?
Yeah.
It's tough.
The thing is, I emailed Ron, and he did some research for me, and I'm trying to find out where the response is. He was looking into it. He said there was some mixed reviews, and he said that there was some problems with buyer's remorse. When schools spend a lot of money and invest in these, the vaping companies are now producing vapors that aren't detectable by the vape detectors.
Of course, okay.
So it's that you come up with a
Cat and mouse.
solution.
That's
Yeah,
how you
totally.
get 'em out
Yeah,
there,
yeah.
So DPH isn't recommending them
Okay.
at this point, and I was kind of surprised because I asked him to look into some grants. He reached out to his contacts for the state, and the overall consensus was, don't do it yet.
Okay.
I was like, kind of like, okay, I thought it would be like a really cool thing, but they had all of these reasons as to why you shouldn't do it yet, and I'll find the email and forward it to you guys. But I was very surprised and shocked because if we can get a grant for it and get them put in, but if the vape companies are onto it and they're getting around it, then it's cat and mouse. You create a fix for it, then they get around the fix. Create another fix for it, they get around that fix too. So I don't know where to go with it, but I did have him do some research for us. He did come back with an answer, not the one that I wanted. But at least it's something that we're definitely looking into and thinking about and trying to come up with a better solution. I don't know what that is yet. I don't think the schools know either.
I know.
But so
I mean,
DPH
it's-
was not looking to give us money for it
Yeah.
at all.
I mean, it seems like it's like, you need to deal with the vaping, but it also seems like a health hazard to not be able to provide bathrooms, so I don't know, like, which
Yeah,
seems
right?
like,
Which
Yeah.
takes
you know,
priority,
like,
yeah.
both are a problem. I understand the school is stuck, but it does feel like it's also taking away a,
Right. I mean, kids are still vaping. Kids can't go to the bathroom.
yeah.
I don't know.
I just don't know what, like, if there, I didn't know if there was anything else we could do. I mean, the middle school is like plastered with vaping education and,
Right.
I mean, obviously, I don't think
Yeah.
putting the same in the high school is gonna change the behaviors, but it just seems like, as a community, there's something we've gotta be able to do to rectify that.
It's
somehow.
interesting. I'm peaked. I want to look at it.
Yeah.
Yeah,
I'll look at it.
All right.
later.
just to see, yeah.
see what I see.
Absolutely. I think that would
I'm
be
interested
great.
from the chemistry as much as I nerd out
Yeah.
on the chemistry stuff. So it's interesting to know it.
I mean,
Yeah.
obviously monitors, I mean, I feel like kids doing illegal things in bathrooms is not a new problem. It is just a new device that they're using in the bathroom. So, I
Right,
mean,
just
this
fair.
goes back for cigarettes, alcohol,
Right.
drugs, like, so I kind of feel like the problem isn't new, it's just what they're doing in the bathroom
Yeah.
that is different.
Yep.
So, you know, I mean, yeah, cigarettes you could smell, but, you know, alcohol and drugs. So, like, it does feel like whatever has worked for probably how many years of high school kids doing things in the bathroom, like, can we just find a way to go back to whatever that was? I mean, I feel like when I was in high school, there was there was a person, there was a
Right.
teacher or a monitor who would
Right.
Yeah.
unfortunately sit there, you know?
Kids have to do community service. They could spend
I know,
2 hours in the bathroom every day.
I know.
Without turning it into a police state, are there some technology ideas around the badges or
I
something?
was wondering the same thing, because they all
Just-
do wear
yeah.
badges, but I don't know if they actually have a scanning
They
ability
probably
on
don't
them.
I
have
think they.
I think it's just an
they swipe.
ID.
It's just an ID.
Yeah,
Right.
Yeah.
It doesn't have the RFID
Yeah.
technology in it.
right,
That would be a whole another set of
Dollar
costs.
signs.
right,
Getting
So-
cheaper every day though.
That's good.
yeah,
Then it's the
Yeah.
detector on the door, and then kids would break those.
yeah. It's hard, it's,
What are you gonna do?
Yeah, right.
yeah.
Just do our best, but I'll keep working with Ron and seeing if there's anything else that we can try to look into to help the schools out.
Or if he's hearing any innovative ideas from
Mhm.
other schools across, I'm sure we're
Yeah.
not the only one with that problem, like.
No, it's everywhere.
Yeah.
But yeah, he did say that some schools are having buyer's remorse because they have them, they bought them, they paid for
It's
them,
not working.
and now they're not working because the kids are using a different type of vape that isn't being detected by the actual vape detectors.
Hmm.
I can only imagine the technology is changing so fast.
Yeah.
Right.
Yes.
With all of
Yeah.
that.
Yep. So we'll see what happens with that. But I just want to give
Okay.
you guys an update from the last tobacco meeting we had. And then grant updates. The FDA grant. We did the FDA grant for standardization this past year. We completed one of the standards. We are halfway through 2 of the other standards. I did put the information in your packets. We completed standard 1. We are still working on standards 3 and 5. We did just put in for another grant for this upcoming year. The paperwork is also attached in your packet. So, standard 1, that is our it's a self-assessment verification audit for regulatory foundation. So basically, it is the regulations that we have and the regulations that we're going to be passing. The inspection schedules, the risk-based asset principal inspection schedule, and good retail practices, compliance and enforcement, and then foodborne and illness preparedness and response are the standards we're going for right now. So we did put it in for a new grant for this coming year. This one is for, it's the last page, it's $30,000, $500 to help us complete the 2 standards we're working on. So we're looking to meet completely an audit, standard 3, inspection program based on HACCP principles. So the regulatory foundation we did, standard 1, standard 3 we're going to complete this year with this additional grant money. We will be passing new food regulations hopefully in the next month. I've been working with our consultant, Maureen Lee, in Mogen Solutions. We've got a draft prepared. I did give them criteria of things that I wanted to include in the new regulations. Some basic stuff, some things that I've seen here that I think would be beneficial, including the risk-based schedule. So things are going to be done based on risk factors versus the DPH standard 2 inspections per year no matter what. So a gas station that sells like prepackaged candy and like coffee, yes, they have dairy products that self-serve, and then prepackaged, very, very minimal, low risk. Do those maybe once a year. And I did include the schedule in your packet. It's a chart like this. And this is the criteria that we based off, 1 through 4. So the very easiest things, the convenience stores, gas stations, hot dog carts, coffee shops, that only serve prepackaged, very easy, low-risk stuff, we done once a year. To number 4, preschools, hospitals, well, we don't have any hospitals, but nursing homes, and then establishments conducting processing in retail, such as ROP, so reduced oxygen packaging of meats, that'll be done 4 times a year. So you have your highly susceptible populations in the nursing homes, and then the preschools, all the way to specialized processes, even like sushi will be done additional times per year versus the standard 2. So that's what we're working on now. That'll be included in the regulations. We will hopefully find out that we will get the grant in January. So that'll help with our consultants and additional trainings and getting us up to speed on the new standards and trying to meet them.
Is this more just something you do periodically, or is there anything kind of keeping you up at night, particularly with regard to any of the codes?
A lot was exposed during COVID when we reduced staff and we had additional responsibilities, where other states are done by county, so they have more staff that they can direct for certain things. We are a Commonwealth where we have a little staff in each town.
Yeah.
We do have mutual aid and we do give assistance to other towns, but when we're all in the same boat, we can't lend each other bodies at the same time because they need them and we need them. So this just kind of got the state more open to the FDA standards and the practices that they do on a county basis for individual towns. It's a heavy lift because it's a lot of work, it's a lot of documentation, the self-audits, the regulations, the rewriting of all your procedures to have them in writing versus a policy that you just do based on DPH's guidance. Now we're going to have written policies, written procedures, training, standardization, documentation. So it's a lot of red tape in there, but it does get you at least everything lined up and all your ducks in a row. So we've been doing it for a year. It's been very productive. We've been making some good headway, and we actually met one of the standards already, which is great. We did standard 9.2, which is the self-assessment and verification, where we go through our entire program and assess the entire thing from top to bottom, and then find all the holes and all the gaps. And that's what we've done so far. So we do have a improvement plan that has been written. We're going to basically be going off of that over the next 5 years to get us up to all the standards. But the funding helps, and having a mentor. Our mentors in North Carolina, they fared pretty well during the floods, but they did have some damage. Newbern, North Carolina. So they're already accredited through the FDA, and they have all their standards done, and now they're helping other communities get standardized.
Will you have to do that as well? Is that part of it?
Probably once we get standardized,
Yeah.
but that's going to be a few, like 5
Right.
years down the road, because there's a lot of stuff, including staff certifications and staff trainings, and then Massachusetts doesn't have any certified FDA inspectors for this, the Retail Food Protection Program. They have your FDA
Right.
inspectors for other things, but not for retail food, which is your restaurants. They do the manufacturing and processes, things like that, but to be a standardized FDA inspector, you have to follow a person for 25 inspections. Then they follow you and audit you for 25 inspections after all of your FDA trainings.
That's comprehensive.
You do all the trainings, and then you shadow, and then you get shadowed. And you're going to pass it all. And then you get standardized. So yeah, there's a lot to it, but and Massachusetts doesn't have any FDA standardized inspectors. So there's nobody that you can go shadow, and nobody that can shadow you. So that's a little hiccup in there.
Yeah.
But they're working on it.
Sounds like they're going to be in high demand
I
as soon as
know,
they
I
do
know.
cross that threshold.
And we're looking at a year or two before that's even close in terms of the standardized inspections. So we're learning it, we're getting the paperwork, we're doing the trainings, and going off of a HACCP-based inspection program versus risk versus just standardized 2 times per year.
Yeah.
And it's more about processes and storage, cooking, handling, serving versus facilities, and they call it the floors, walls, ceilings. If your floors are cracked, okay, yeah, you gotta fix it, but it's not a high priority. You want the temperature coming off the grill, the food, cooked at the right temperature versus worrying about cracked tile. And that's that. that's where we are now, and hopefully we get another couple $1,000s in the near future to continue with the FDA program.
It's way off in the future, but you could anticipate if you were in demand, hopefully there's some kind of additional money in the grant to either build up in staff or
That would be
accommodate the
nice.
fact that you're going to be pulled, you know, because you
Yep.
could easily see if this becomes a flagship for the state. I mean, just
Yes. Luckily, a lot of towns are now doing this because
Okay.
the FDA is giving
so
us
it's a
money.
lot of simultaneous folks that are
Yes.
Okay.
Yep. There's
so
a bunch of towns in the area doing it. We're all doing it
Okay.
together.
that lessens
um,
a concern.
Yep. Linfield is one step ahead of us. They're in their 3rd year. We're in our 2nd year. Andover is also in their 2nd year. So we're on par, but a few towns in the area are doing it, which is good. So we've got people to bounce stuff off of and work
Just
with.
spread the load.
Yes.
Got it.
Yeah.
Okay.
That's it.
Cool.
Curious, did we wind up getting another tobacco license handed back in, or is it still a work in progress?
It's the work in
Oh,
progress.
Okay, just
So
curious.
you know they haven't
Saga
returned one back yet.
continues.
I know, I was trying to think of all the things that were kind of hanging
Yeah.
out there, but I knew that was one that was hanging. Okay.
No, I haven't been in Quick Picker Mechanisms in a while, but they were under construction last month. So I'm assuming it's done right now, but I haven't been back in.
And as long as there's not a wall in between, they could forfeit one of their
They
licenses.
totally could. We've had
Pretty wide open.
yeah, is it? Oh, okay.
I was there the other day. I had
Okay.
a quick pick for something for the kids.
Yep.
And it's pretty wide open in there.
Great.
Looks good.
So is
Okay.
that something we need to ask them, or did they?
I can talk to Chris about it. And go,
Yeah.
okay, we guys have 2. Do you want to give one back? Because people are dying for him.
Right.
No pun intended.
Okay.
Sorry, that's bad.
Any questions for anybody?
I was asking them contemporaneously. No,
Was
I was asking them
Oh.
As we
you know,
went.
as we went.
Okay.
Anything else from anybody in the room? No? Okay.
Derek, nothing?
No, no,
Start a whole nother conversation, that's okay.
Awesome. But yeah, if you guys want a little light pleasure reading, read through the standards, and this is what we're working on. It's very entertaining.
Well, before we adjourn, just on behalf of the whole board, thank you to everybody for all your hard work this year. Always a lot going on, and you guys make it seem so seamless and easy, and especially this year where you had quite a few staffing gaps over the year. Thank you,
Yep.
Brian.
You're very welcome.
For hanging in there.
It's been interesting. I know I have help, so I'm very, very happy.
At least you can wrap up the year with like full staff, right?
Exactly.
So, always a good thing. So, thank you and happy holidays to everybody. And then with that, and we'll take a motion to adjourn the meeting. Whoever wants.
I move that we adjourn the meeting.
I second.
All those in favor of adjourning the meeting?
Aye.
Aye. Okay, we are officially adjourned.